Hello, everybody, and welcome to AUI University. This month, we will be talking about employer Medicare responsibilities. One of the reasons we chose this topic is I get questions all the time. Your customer support specialists get questions all the time with Medicare. We get them from employers, employees, it's all across the board, and no one question comes more often than any other. So, a little bit about me that you've all heard from me before. I'm Alice. I've been at AUI 21 years now. So, I tell everybody I started when I was 10. I handle all of our compliance, our HIPAA stuff. I'm an active member of the National Association of Health Underwriters, or NAHU, and I hold certifications from NAHU in wellness, single payer systems, and self funding. And then in 2016, I was certified as a drug free workplace trainer. So we get questions all the time too. People get confused. They don't know what Medicare is. They get it confused with Medicaid. So Medicare was a law that was originally passed in 1965, and it provided insurance to people over age 65 and also people that have certain disabilities. So, Medicaid, on the other hand, is for low income individuals. Certain people will qualify for both Medicare and Medicaid, and they are referred to as dual eligible. So, Medicare has different parts to it. And this is where people get confused. They don't know what the parts are, they don't know what they mean. And then when you get into different plans associated with Medicare, those have their own parts as well. So, in a nutshell, Medicare Part A is the hospital portion of Medicare. There's often no charge for it as long as you've worked enough quarters. If you haven't, you can purchase it, but it's not the most reasonable thing out there. Part B is the doctor portion of Medicare. There is a premium paid to Medicare for it, and that is deducted out of your Social Security. If you are not drawing Social Security yet, then they send you a quarterly bill for it. Medicare Part C, because people say, hey, A and B, what's C? C is kind of the classification of Medicare Advantage plans, or basically privatized Medicare. And then Part D, and this, once you hear this, makes total sense. Part D is your prescription drug coverage. So, Medicare can either be primary or secondary to your group health plan. So, if you're an employer with less than 20 employees, Medicare is primary for your employees. If you have less than 100 employees and you have an employee that's on Medicare due to disability, then Medicare is primary. So, depending on why somebody is on Medicare will determine that employer size, and then who is primary or secondary. Usually, though, that 20 employee rule is the law, the law of the land. Um, the above situations also assume that the employee is actively at work. I stress this because I've seen it happen where people go on to, they're over 65, they've stayed on their employer plan, and then they just elect Cobra because that's what they think they should do. Well, after that, then, group or Medicare is going to be primary once they're no longer actively at work. And then claims don't get paid and it gets ugly. And then there are also special rules for people that are on Medicare due to end stage renal. And that's one of those, whenever it comes up, I've got to pull out the guide because it doesn't make sense. And it's like it doesn't come up often enough that I can keep it straight in my head. So if Medicare is primary, then the employee needs to have both Medicare Part A and Medicare Part B. If they do not have Part B, then the insurance company doesn't have anything to pay secondary against, and then often won't pay anything at all. So again, this is what I've seen happen. Like I said, somebody elects Cobra, thinks that's what they're supposed to do. They were on their employer plan all these years, and that's what they just need to do. Well, then when those claims start hitting, 2, 3, 4 months down the road, they're paying all this premium for a plan that doesn't have anything to pay against. So unless they have A and B, it doesn't, it's not paying against anything, and it doesn't pay at all. So you've got somebody that's paying, these higher Cobra premiums and isn't real happy. And a lot of times they just don't know. They don't, people don't think about it. It doesn't know. They don't know. As a Cobra rule, you have to offer it to them, and they just take it. It's not anything that's in that Cobra notice. So if Medicare is secondary, so if you're an employer with more than 20 employees, that employee does not need to elect Part B. So I usually suggest they don't, because then they have to kick into paying that Part B premium. They can, and people often say, hey, but there's a penalty if I don't take Part B. There is, but as long as you have employer coverage available, or that you're on, then that penalty does not apply. There's a form you'll need to complete. It's to be specific, it's the CMSL 564 form that the employee will get, and then they will need some information from you to complete to send in so they can get their Part B with no penalty. So Part D. So again, Part D is drug coverage. So it was initially effective January 1st, 2006. Prior to that, if you were a senior on Medicare, you didn't have prescription drug coverage. So as these drugs were coming out, they were very expensive, and especially the seniors on fixed incomes, they didn't have any drug coverage. And some of these drugs are very expensive. Is it one of the most common drugs I see anymore? It's one of those drugs, it's about $500 a month. So what the Part D rules did is it gave eligible individuals access to Part D coverage through private plans that are approved by the federal government. So it's not like you just go, buy Part D from the federal government. You buy it from an insurance company, WellCare, Envision, they have a new name, Elixir, Aetna has them, Anthem has them, Express Scripts. There's a whole slew of them. There's something like 50 different plans available in Summit County, in different plans from each carrier. So each one of those plans has different costs, not just in premium, but different costs for the drugs. And then they cover different drugs at different levels. So I always recommend, if somebody wants to know how much their Part D is going to cost, we can run a report based on their specific drugs, and it will tell us what the most reasonable plan is for them. Because just because a plan is more expensive does not mean the copays are less or covers their specific drugs any better. Because I've had that happen too, where you have some people, they just want it because it's more expensive, but it doesn't necessarily mean it's going to cover their stuff any better than any other plan. If you are considered low income with modest assets, you could be eligible for assistance with Part D premiums, and then the cost sharing on the prescriptions. Part D, you can sign up during their initial enrollment period when newly eligible for Medicare, so that 65th birthday. Or every year, an individual can make changes or elect during the annual election period, also known as AEP, and this runs from October 15th through December 7th. If an individual doesn't join a Part D plan when they're first eligible and has no other credible prescription drug coverage, a late enrollment penalty may apply. So that late enrollment penalty, it applies if the individual goes without Part D or credible prescription drug coverage for any continuous period of 63 days or more. The penalty is 1% per month for every month they were eligible but didn't have credible coverage. So, and it's not based on the, the premium of the most reasonable plan. It is based on the average cost of a plan, which right now is approximately, $35 a month is where they base that 1% off of. So if you're somebody, I ran into it this past AEP, had a gentleman, I've helped his daughter-in-law for years. She was like, hey, I like this plan I have. I want to sign dad up for it. So we started looking at it, found out he had never had Part D coverage, and this gentleman was in his early 90s. So this 1% per month penalty was going to go all the way back to 2006. So we kind of determined that, that penalty was going to be about $80 a month. That probably, he may just want to continue doing what he was doing because it had just been so long. And this is a gentleman, he never knew that he needed it. So as an employer, you have requirements you have to do. So you have to give credible coverage notices to your Medicare eligible employees annually. CMS does have a model notice, and this here is a link to that notice. And then you also have to notify the Centers for Medicare and Medicaid Services. And they have a link right here, and it's confirming, how many people you have, that you gave this notice to. I always recommend, if you're not sure, you can either hit it to everybody. It doesn't hurt an employee to get that notice if they don't need it. But if you specifically want to make sure you hit anybody over age 64, because then, they're going to turn 65 that year and they're going to need it. So your notice to the individuals, if you decide not to use the model and want to come up with your own, it has to say whether or not the coverage is credible or not, because if it's not, that penalty is going to kick in if they don't elect something. It also, in typical required notice fashion, it has to talk about the rights of the beneficiary to the notice, has to discuss coverage options, and then general information about how a Medicare drug plan works. You may put this notice in. If you do an open enrollment packet, you may put that notice in there with all of the other information you're giving them. It does not have to be separate. It has to be done before the Medicare annual open enrollment period, so October 15th through December 7th. And then some of your carriers will provide this notice for you, but it's your responsibility to make sure it is done. So very important as well, because this comes up quite often. If you're an employer that the group is primary to Medicare, so if you have more than 20 employees, you're not allowed to even mention to them that they can come off of your plan. You cannot entice them to go on to Medicare. You can't say, hey, I'll give you a raise if you, come off our plan and you go on to Medicare. You just can't do that. It's against the CMS rules. But if you're a group where Medicare is secondary, so you're less than 20, there are certain situations you can do this, but I always suggest you consult your legal counsel before you do anything. You don't want to end up with an age discrimination suit. So also, this happens too. I think they go in spurts and waves. I see them come through. There's an IRSSSA, which stands for Social Security Administration, CMS, which is Centers for Medicare and Medicaid Services Data Match. Back, especially since the beginning of the Affordable Care Act, these three systems talk to each other. So the purpose is to identify a situation where another payer has the responsibility of paying before Medicare. So like an employer-sponsored group health plan. You may receive this letter from CMS requesting information. I've seen them come in about specific claims on specific people. Usually what happens is we have to get the insurance carrier involved. They have whole departments that deal with this, and you have 30 days to respond. If you don't respond, there's a civil monetary penalty of up to $1,450 for each individual that an inquiry has been made. If you would like to hold a Medicare 101 for your employees, we can set something up. Or if you have a specific situation you want to discuss, or your employees have, if you want to stay out of the middle of it and have them come to me directly, here is my contact information. Don't hesitate to have them reach out. Again, we are here to help you and help your employees do what's best for them and you in the process. I want to say as well, thanks for listening today. And this information is current as of May 5th, 2021. So anything that changes after today is not addressed. So thank you very much and have a fantastic day.